And right now we're answering your questions about the coronavirus and children with Cone Health's Pediatric Services Executive Medical Director, Dr. Michael Cinnamon. You can continue to text your questions. In the meantime, let's go with what we have here. The first one is, does the vaccine affect a child or an adult's DNA?
It absolutely does not. And that is, I'm glad you asked that. It is a very common question that we get. People know that there's messenger RNA in the Pfizer vaccine, which is the vaccine that has been approved. But of course, the science behind it is rather technical, even for some of us. And it's kind of amazing how they came up with this and how it worked. But messenger RNA does not go into the nucleus of the cell, which is where the DNA lives. It doesn't alter the DNA or go into the center or the heart, the nucleus of the cell. So DNA is not altered, changed, touched in any way, shape, or form. The messenger RNA helps the cell create a protein that goes on a surface that mimics what would happen if you were infected by the coronavirus. And therefore, that is how your body mounts an immune response and is able to fend off the coronavirus.
I know this is a concern for a lot of parents. They want to know, does the vaccine cause infertility? Is that something that they're going to see in their children down the line?
No, there's absolutely not a shred of evidence. Another conspiracy, if you will, or however these rumors get started, but there's nothing about the vaccine or the material in it or anything about the way that it would work that could cause infertility, nor is that anything that anybody has actually seen in evidence at all. So the short answer is absolutely not.
Okay. This text question comes from our own Megan Malaris. She says, my child is younger than 2, so he's too young to wear a mask and too young to be vaccinated. Is he now potentially at increased risk in public places that don't require masks?
It's a great question. 2-year-olds do not generally wear masks very well, so they've been generally going around without masks this whole time. The good news is, which she probably knows, 2-year-olds, the younger you are, the lower your risk of even if you were to catch coronavirus to have any type of symptomatic problem at all. It's fascinating. We don't really understand why the youngest of young are spared to a great degree, not completely, but to a major degree from adults. But the key point here is as more and more of our population gets vaccinated, which again appears to be phenomenally effective at preventing the carriage or transmission of the disease, the less and less risk it will be for that 2-year-old, which is why we encourage everybody who can get vaccinated to get vaccinated.
Not just for you, but for other people as well. All right, so this person is asking, why is Pfizer the only vaccine approved for kids?
There's no specific reason and nothing special about their vaccine, really. They just got a little bit ahead of the game in terms of doing the studies. They studied, they were the first vaccine that when they achieved emergency approval from the FDA, it was approved down to 16 years of age, and none of the other vaccines, were studied in that age population. Their 12 to 15-year-old data, they started studying that patient population sooner, and therefore their results were available sooner. The Moderna vaccine and the Johnson & Johnson vaccine have studied this age population, but we've not seen the final results of those yet. But I don't think there's anything really intrinsic about the vaccine that makes it different.
Okay. This person is asking, when will the vaccines possibly be approved for kids who are younger than 12? Do you see that happening?
We do. In fact, the next age group that's being studied is the 5 to 12-year-olds, and even younger than that, they will be starting to study very soon. One thing that nobody asked, but the dose of the vaccine for the 12 to 15-year-olds is exactly the same as it is for adults.
Interesting.
Totally the same. And the way it's given is totally the same, 2 weeks apart. 3 weeks apart. 3 weeks apart, my mistake. And then 2 weeks after that second shot is when you're considered
fully vaccinated.
Fully vaccinated, and all the data about being much more risk-free that's the kind of the date that all gets started. So that is all exactly the same for 12 and 15-year-olds. When you get under that age, they're studying different doses of the vaccine to see which is effective and has the least side effect profile. But we are very hopeful in the pediatric world that maybe 3 or 4 more months we'll see some data, because lots of parents have questions about this before sending their children back to school. I think in the ideal world,
Sure.
We'd be able to start vaccinating children before the school season started in the fall, but I don't know that we have the answer exactly about the timing of that yet.
Okay, we're going to continue to take your text questions. We'll be right back for our last segment.